Alright, and thanks for checking out another edition of Terms Defined. This one is going to be about something quite serious, HIPAA. I'm sure you've heard of HIPAA, especially if you're employed in the US. It's a common theme for jokes in television shows and so on, and people cite it often incorrectly when referring to their protected health information at work, what they can share, what they can't share. So, again, the Health Insurance Portability and Accountability Act of 1996, or HIPAA, otherwise known as the Kennedy-Kassebaum Act. It was signed into law by Bill Clinton in 1996, and it was primarily created to modernize the flow of healthcare information. So, your protected health information includes a lot of different things, and it's to make your health insurance coverage portable and to make your health information accountable and those who have access to it accountable. Now, I may have a little bit of unique perspective on this, as I was an insurance agent from about 2002 to about 2005. I was actually licensed in 49 states and Washington, D.C. And I had my own agency for a couple of years in there for a while, and I've also been a medical records tech. And I currently work for a lab testing company that does food safety testing, so I've got a bit of experience regarding HIPAA. Now, the Health Insurance Portability and Accountability Act of 1996 includes 5 provisions. So the first one is involved with healthcare access, portability, and renewability. This establishes things like COBRA, if you leave your job, or if you enroll in a plan or late enroll in a plan, there are provisions in there. I won't get into the specifics of it because it's very long and involved, but that's what provision 1 is. It's healthcare access, portability, and renewability. So it all has to do with creditable coverage, and which is a quite widely defined term. It includes individual health care plans, health insurance, as well as Medicare and Medicaid. And it establishes requirements for what a significant break in coverage is, which would be a 63-day period without any creditable coverage. And there's an 18-month provision regarding leaving group health care plans. So if it exceeds 18 months and you renew, there's all kinds of provisions about that. I'm not going to get super in-depth into Title I, because the most important part about HIPAA is actually Title II, and I'm going to cover that last because it's pretty complicated. So Title III has to do with a very simple thing. It's cafeteria plans. So if you're using pre-tax contributions to pay for your health insurance, that's involved with Title III. And that standardizes the amount that may be saved in pre-tax contributions. It also establishes medical savings accounts and so forth. Title IV is the application and enforcement of group health insurance requirements, and that's the part that includes the COBRA clarification. And it also involves things regarding pre-existing conditions. It also modifies continuation of coverage requirements, hence the COBRA. And if you're wondering what COBRA stands for Consolidated Omnibus Budget Reconciliation Act of 1985. Title V has provisions related to company-owned life insurance plans. A lot of employers out there provide free life insurance coverage for their employees, and Title V is about that. So let's talk about Title II real quick. Well, it won't be that quick because it's pretty involved, but Title II is to prevent healthcare fraud and abuse, administrative simplification, and medical liability reform. So basically the point is your protected health information is yours, and your protected health information includes all kinds of different stuff from your name to your charts. And medical records come in all kinds of different forms nowadays. Where I worked, some of the medical records were in the form of electronic documents from day one. In other words, they were never paper documents unless somebody printed them out. And other documents started out as paper documents and then became electronic documents because of what our department had to do, which was scan charts. So that was the majority of the work that our medical records department did involved the processing, scanning, and indexing of medical charts. So the all of the units at the hospital would all send their paper charts to a centralized location, and the medical records staff would have to organize the charts in a certain way, pull out records that are already electronic, um, do all kinds of mechanical stuff to make sure that the charts would scan correctly, and then scan. And we would typically scan, one employee would typically scan like 50,000 pages of medical charts in one shift. That was actually, you could do more than that, but the point is, it's pretty easy to transmit electronic medical records. Now, if you request your health information, any provider needs to get that to you within 30 days. That's kind of the rule on that. And you can request it in paper form or in electronic form. I highly recommend electronic form because providers are encouraged to provide the information more quickly then. And let's just show a chart here about HIPAA violations. And there's the pie chart. So you can see most of the time HIPAA violations are because of data being physically stolen. So whether it would be, just a paper chart. So only 6% is compromised by hackers, 5% improper disposal of data. Data lost or not accounted for, 12%. And data disclosed without authorization from patient, 20%, and other 2%. So there's some idea about what the violations would be. So Title II establishes policies and procedures for maintaining privacy and security of individually identifiable health information. So you can disclose whatever you want about your own health information, but nobody is legally allowed to force you to do so unless it's because of like a subpoena or a warrant, or a judge telling you in court that you've got to do it. Although in that case, there still should be a written requirement. So, and there are a lot of different entities that may have some of your protected health information. For instance, if you call an insurance agent and he asks you medical questions, they may keep a record of some of your protected health information because they may be asking you about pre-existing conditions. So the implications of disclosing your medical information are super important, as they can affect things like how much you pay for insurance coverage, to whether you're able to get certain types of insurance coverage. For instance, if you have Alzheimer's disease, you won't be able to buy long-term care insurance. So there are pre-existing conditions, and by the way, long-term care insurance isn't. Don't confuse that with regular health insurance. That's just insurance to pay for things like home health care, assisted living facilities, and nursing homes. And the reason I bring that up is because that was my area of expertise initially in the realm of insurance sales. So the most significant provisions of Title II are the administrative simplification rules, and it requires the Department of Health and Human Services to increase the efficiency of the healthcare system by creating standards, national level standards, for the dissemination of healthcare information. So the electronic medical record is very useful because it saves lives, because it allows entities to transfer health information very quickly. One of the roles that we had to do in the medical records department was if a doctor or hospital or a clinic would call us, they would need to fax us the authorization to release information form, which is the form that you're required to sign in order to receive your information. And of course, if you're unable to fill out the form, then a doctor can send it. And the electronic medical record makes this much easier because we would look up only the information that they wanted, and then we would only send the information that they wanted. For instance, if they wanted all the labs or they wanted all the EKGs from the last visit because they're having heart problems, That's the kind of thing that would go on. And so anyway, Title II of HIPAA, the Health Insurance Portability and Accountability Act of 1996, is the one that people are constantly citing. And it's kind of important, but again, you have the right to disclose or not disclose any of your medical information. And your protected health information includes basically anything about you: your name, your address, your phone number, whether you have insurance, whether you don't have insurance, whether you have certain conditions or not. All of that stuff is yours and yours alone. So I just figured I would do a short video here about this because people don't really seem to understand HIPAA. I mean, there's a great Wikipedia article that I'm just like literally reading from right now because it's a little complicated. And let's just say the Affordable Care Act didn't really help because that thing is about, what is it, 12,000 pages long or something like that. It's almost as bad as the tax code in the U.S., but HIPAA is a good thing. And by the way, it has not expired. So if you've noticed that your employer required you to sign some sort of a disclosure acknowledgement in order to ask you health questions at work, such as whether you have a fever, well, that's protected health information. So you can choose not to disclose it if you like, and your employer might choose to fire you because of it. But that's the point. And lots of liability gets created when any of this stuff is messed with. So, you can do, let's just say you can cause significant harm to somebody by disclosing their health information. Like for instance, when Lance Armstrong got cancer around 1996, he had his contract voided with Team Cofidis, and that's part of the reason why he went on to vengefully win 7 Tours de France while cheating, because part of it was to be like in-your-face Cofidis, because they decided to unsign him from the team because of his cancer diagnosis. So again, the implications of providing access to your health information are super serious. So just keep that in mind. And again, you can read the Wikipedia article, HIPAA, the Health Insurance Portability and Accountability Act of 1996. And anything else about that? Hold on a minute. And that's basically it. I don't really want to get too much in depth into Title II or any of the titles because it's pretty complicated, but it's designed to protect you from fraud, abuse, etc. And really it does create liability for anybody that shares your information. And that's why it's pretty strictly handled at your employer, because massive lawsuits can happen. Indeed, UCLA actually paid a large settlement. Now, the hospital that I worked at, people would accidentally look at records all the time. If you just simply type in the wrong medical record number, you're going to get somebody else's medical record. So it happens all the time. And, medical records departments are trusted to be able to handle it, just like, medical records departments are trusted to handle your information a little more seriously than insurance agents do. But they all ultimately have the same requirements. And again, your health information is yours, nobody else's. You can request it. Anybody who has your protected health information needs to provide it to you if you request it. And that's it. So thanks for tuning in to another episode here. Episode 2 of Terms Defined, HIPAA. We'll be coming at you with more content soon. Check the links below the video. And please support the channel if you are willing, ready, and able. Thanks again. And protect that health information.